Presentation on cystic fibrosis. A presentation by Junior Bakwa on a course Human Biology and instructed by Kelly Austin. Introduction. The respiratory, digestive, and reproductive systems are all affected by the hereditary condition known as cystic fibrosis. It is brought on by a mutation in the cystic fibrosis transmembrane conductance regulator, gene, which results in the formation of tics, stachy, and mucus that clogs the pancreas, the lungs, and other organs, a life-threatening condition. Cystic fibrosis necessitates continual medical attention and control. Signs and symptoms. Cystic fibrosis can cause a wide range of signs and symptoms, but frequent ones include persistent wheeze, coughing and breathlessness, recurring lung infections such as bronchitis and pneumonia. Despite a strong appetite, there is poor development and weight gain, having trouble passing stools, and having plenty of oily bowel movements, male infertility, and declining female infertility. Due to the ability to make people tired, have breathing problems, and be less able to engage in physical activity, these symptoms can have an effect on daily life. Risk factors. Being a genetic disorder, cystic fibrosis is brought on by change in cystic fibrosis transmembrane regulator gene. Cystic fibrosis is a disease that affects people who inherit two copies of the defective gene, one from each parent. Couples who both carry the cystic fibrosis transmembrane regulator mutation run an increased risk of giving birth to a child with cystic fibrosis. The majority of cystic fibrosis transmembrane regulator mutation carriers, however, are asymptomatic and do not have the disease. Effects on anatomy and physiology. Along with other organs, cystic fibrosis has an impact on the digestive and respiratory systems. According to Cystic Fibrosis Foundation, the thick mucus that cystic fibrosis patients create can block the airways, causing chronic lung infections, inflammation, and scarring. Malnutrition and malabsorption can result from cystic fibrosis' ability to obstruct the duct in the digestive tract and transport digestive enzymes from the pancreas to the small intestine. In addition to harming other organs, cystic fibrosis can also gradually harm the liver and reproductive system. Diagnosis. Imaging investigations, genetic testing, and clinical examination are all used to diagnose cystic fibrosis. The sweat test, which analyzes the quantity of sweat in a person's perspiration, is the most often used diagnostic tool. The cystic fibrosis transmembrane regulator gene mutations can also be found by genetic testing. Mucus and lung injury can both be seen during the imagination test, including chest X-rays and CT scans. Prevention. Genetic counseling and carrier testing are two cystic fibrosis prevention strategies. Informed decisions about family planning can be made by people and families with the assistance of genetic counseling. According to the American College of Obstetricians and Gynecologists, carrier testing can detect people who have a single cystic fibrosis transmembrane regulator mutation and are at risk of passing that mutation to their offspring. Demographics. People of all races and ethnicities can get cystic fibrosis. However, those with a Northern European ancestry are more likely to do so. In the United States, the condition affects roughly 1 in every 3,500 live babies. Males and females are both equally likely to get the illness. Treatment. Cystic fibrosis is often treated with a mix of prescription drugs, physical therapy, and dietary changes. Infection management, lung function prevention, and nutrition and growth optimization are among the objectives of treatment. The treatment for cystic fibrosis must include medications. Mucus thinning medications aid in clearing airways and enhancing lung function, whereas antibiotics are frequently used to prevent and cure lung infections. The management of symptoms can also be assisted by other medications, such as bronchodilators and anti-inflammatory drugs. Nutrition. For those with cystic fibrosis, proper nutrition is essential to long-term health. People with cystic fibrosis can maintain a healthy weight, enhance lung function, and avoid malnutrition by eating a well-balanced diet that provides enough calories, fat, and protein. Exercise. Cystic fibrosis patients must also engage in regular exercises. Exercise can enhance strength and endurance, enhance lung function, and enhance general health. In addition to lowering the risk of infection and increasing respiratory function, exercise may also aid in clearing mucus from the lungs. New cystic fibrosis medicines are continuously being developed by researchers. Gene therapy, which tries to fix the genetic mutation that causes the disease, is one promising field of research. The development of novel medications to enhance lung health and stop infections is the subject of more research. Conclusion. In conclusion, the respiratory and digestive systems are impacted by the devastating hereditary condition cystic fibrosis. It can cause a number of difficulties and have a big influence on one's quality of life. But with the right care, people with cystic fibrosis can control their symptoms and lead normal, active lives. Current studies are advancing our knowledge of the condition and creating novel therapies, providing cystic fibrosis patients hope for a better future.